I know everyone's freaking out about AI and insurance limitations, but let's be real. The biggest headache in physiotherapy is when experienced physios leave and take all their know how with them. You're suddenly thrust into new challenges, staring at someone else's patient notes and thinking, what on earth were they thinking? We've all been there, feeling like an imposter, overwhelmed, scrambling to figure things out, and when that knowledge walks out the door, patient care suffers, and our whole profession takes a hit. I remember a patient who had seen 6 physios in 6 weeks, each one giving slightly different advice. By the time she reached me, she was confused but still improving. Luckily, I had some functional home exercise handouts ready. Yes, I have prepared handouts, and we got her discharged and she did very well. But honestly, we could have done better. If we had just shared what had worked earlier by sharing experiences, documenting approaches, and mentoring each other, we can preserve our collective knowledge and take our profession to the next level. That's why we're here today, to explore how you can hold on to clinical wisdom that makes a real difference, fast track your expertise without sacrificing your well-being, and contribute to the profession's growth in a way that feels sustainable and meaningful. Let's dive in. Section 1. Beyond Physio Textbooks, How to Preserve and Apply Clinical PT Insights. With your physio degree in hand, you're ready to take on the real world, but the true magic happens beyond the textbooks. It's a messy, nuanced patient interaction that you'll develop physio street smarts. I learned this the hard way early in my career. I had a post-op knee patient who was on paper ready to progress, but something didn't feel right. My gut told me to hold back, and looking back with that pause, it was a game changer. We can't always push our patients to their limits. This woman was dealing with some tough family situation, and her head wasn't in the game. So we took a step back, let her get her bearings, and waited for her to be ready to dive back in. And when she was, she crushed her rehab. It's funny that sometimes you need to slow down to speed up. It's a bit of a sticky wicket, to be honest. And that's when it hit me. Evidence-based practice isn't just about research papers. It's about blending evidence with your own experience and what is right for each patient. Some seasoned physios have a sixth sense, a secret Jedi wisdom for calming anxious patients or adjusting techniques on the fly. You've probably seen it. Those physios who just get it, effortlessly navigating complex situations with ease. That's tacit knowledge, and that's the kind that goes beyond textbooks and research papers. Street smarts is what makes a good physio great. They're about reading the room and adapting in real time, navigating tricky patient dynamics or funky clinic politics with confidence and ease. And when experienced physios leave, that knowledge goes with them, unless we take steps to preserve it. So that's how you start building and preserving that wisdom. That's why we're here. I have 3 strategies. Number 1, use protocols as a guide, not a rule book. Build on them and trust your instincts when it matters. After all, the goal is to help, not to make things worse. Number 2, reflect regularly on patient encounters. Take a minute to jot down what worked and what didn't. It'll help you refine your approach. Don't worry if it feels awkward at first. Every insight you write down is a win. And this isn't more mindless paperwork. This is helping you get ready for your future. Keep going, you're doing great. Number 3, find a mentor and don't be afraid to ask tough questions like, why did you do that approach right there? It's not just about the seasoned veterans who can offer valuable insights. Your peers and even your assistants can be a great source of knowledge. I've worked with some amazing assistants who've taught me a thing or two about handling tough cases and navigating sticky situations. You'll pick up on some great tips and learn from people who might not have had all their gray hairs yet, but that they've got the experience and insights to give you to share. And here's the thing, with mental models, you can turn your street smarts intuition into banging clinical decision making. Think of mental models as a framework that helps you trust your gut and instincts and make reliable, repeatable decisions. They organize your on-the-job experience into structured approach that you're not staring at a blank state every time you have a new patient. We'll dive into refinement of this process in section 2, so hold your horses. But for now, let's focus on the basics. Mental models give you mental shortcuts for smarter decision making, saving you time and energy. This way, your insights from experience become rock-solid clinical reasoning. A powerful example is my simplified physio approach. I have 3 diagnoses: overuse, traumatic, and systemic diagnoses, and 3 treatment phases: pain management, recovery of motion, and strength balance mobility. This streamlines clinical decision making and makes communication easier, provides a clear roadmap for you, your team, and your patient. And when you use and tweak these models, talk them through with others. Jot down your successes and challenges. You're not just growing, you're making sure that that hard-won knowledge doesn't disappear into thin air. Section 2, measure, refine, repeat. data-driven physio to improve patient outcomes. You already started sharpening your clinical instincts. Now let's back those instincts with some solid data-driven insights. As a physio, tracking what works for your patients is crucial for delivering effective care. Tracking isn't busy work. It's how you refine your approach to get your patients better, faster. When I started tracking my knee replacement range of motion, I was surprised by what I learned. Restoring full knee extension early on was key for walking, and once we achieved that, we could focus on pushing knee flexion range of motion because everyone wants knee flexion range of motion. It was a game changer for my treatment approach and my patient outcomes. Tracking what was working with my patient really helped me hit the nail on the head when it came to adjusting my own knee rehab approach. So how do you actually use your data in a day-to-day practice without drowning in spreadsheets? Here's how I started. Number 1, track outcomes systematically. Focus on 1 or 2 conditions like frozen shoulder or wrist fracture patients. Collect data and track relevant outcomes like how long before those shoulders were functional or how long before that wrist fracture patient could actually use their hand. Number 2, take a look at your data and see what stands out. Are there certain techniques that consistently help patients improve faster? Ask yourself what's working, what's not working, and what's the next step. If motion isn't improving, try something different. Try adding heat or a different manual therapy technique. Number 3, use what you've learned to tweak your approach. Even small changes can make a big difference. Use your data-driven insights to refine your treatment approach. Adjust your protocols, and optimize patient care. So in my mind, my frozen shoulder patients almost always get heat and manual therapy if they're below 90 degrees of flexion, or heat and manual therapy for those wrist fracture patients if they have trouble closing a fist. By continually refining your approach based on what works for your patients, you'll be able to provide more effective care and improve patient outcomes. You won't get it right away. It takes time, and that's okay. Learn from what didn't work, borrow what does work, and keep getting better. Section 3, giving back to PT, sharing your physio insights. We've all heard that phrase, think globally, act locally, but in the thick of patient care, it's easy to get caught up in the daily grind. For me, that means focusing on the patient in front of me with little bandwidth to think about the bigger picture. It reminds me of something Aristotle said, that your responsibility starts with yourself, then your family, then your community, and eventually to the wider world. In physio, that starts with getting your clinical house in order and grows from there. In our profession, it's essential to start by getting your clinical life in order. We discussed the importance of having a mental model and a system. Remember section 1? It's easy to slip into autopilot, but finding small ways to keep improving keeps you engaged and evolving. That was the track, reflect, and thrive mindset from section 2. Remember that? Start small. Maybe discuss one tip with a fellow physio over coffee, or create a simple handout for an education point you keep running across. Share it with your colleagues. Ask for feedback. Maybe they can use it, or do they have a suggestion to improve it. This small act of sharing can spark meaningful conversations, refine your approach, and even inspire others to pay it forward. Just give it a go, eh? You might surprise yourself. I started by creating my own educational handouts, which helped me solidify my approach and share it with colleagues and refine it over time. Consider mentoring students. It's an excellent way to pass on your knowledge, reinforce your understanding, and connect with your passion for physiotherapy. As the saying goes, you never really know something until you have to try to teach it. Even if it's something small, what you've learned could really help someone else. Don't underestimate that. Whether it's a quick tip or a blog post or sharing with a coworker, you're adding to our profession's collective wisdom and ensuring that it benefits future generations. That's why I'm creating these videos. So aim high if you can. If not, then focus on making a positive impact on your immediate circle. Being positive influence to those around you is invaluable. Don't forget to take care of yourself too. Burnout is real. No one is able to win if they're running on empty. Set boundaries. Think sustainably, pay it forward, just like the physios who helped you get you where you are today. Sharing what you've learned doesn't need to be complicated. It starts with something small that you can do every day, noticing what works, learning from your peers, and storing those lessons for later. It all adds up. Every patient interaction helps shape how we grow as a profession. Start small, write down something you've learned today and bring it up with a colleague. That simple step keeps the knowledge moving. Those small insights help you, and they quietly shape the future of our whole profession. If something here clicked with you, drop it in the comments. What's one change you're going to try this week? Cheers for watching. My 2 books are now available at Amazon. What they don't teach you about documentation in physiotherapy school, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Time for an amazing video adventure, this one right here, and subscribe to receive delightful surprises with every new release. Thank you.